Health now, a heat treatment for ovarian cancer. Local doctors tell us this type of chemotherapy may even provide a cure for some patients.
I feel fine, like I did before the whole mess started.
That whole mess is ovarian cancer. Like many other patients, Kathy Finney says it spread silently without symptoms.
I had none, except all of a sudden, about a week before this all went down, I had difficulty urinating.
A retired nurse, Kathy called her doctor, even though she believed it was no big deal.
I felt like a fool. I had no symptoms. I can run upstairs. I can walk miles, and I'm always going. My daughter-in-law calls me the hummingbird.
But then Kathy got the diagnosis, ovarian cancer, stage 3 out of 4. That was 9 months ago.
I never smoked. There were never any drugs, anything like that, and I've tried to eat a healthy diet all my life, but things can still happen even if you do everything correctly.
The CDC confirms most patients who develop cancer in their ovaries are just like Kathy. They have no high risk factors such as a genetic mutation, endometriosis, or trouble getting pregnant. And right now, there's no screening test like there is for cervical cancer. That makes ovarian cancer very difficult to detect early.
So most women do present with a stage 3 or 4 ovarian. We rarely find it at a stage 1.
Dr. Katina is a gynecologic oncologist at Tufts Medical Center. She tells her patients to think of their abdomen as a big balloon.
And ovarian cancer spreads by sticking to everything floating in that balloon, which is the bowels, the liver, the stomach, all of those things.
But even with standard treatment, which is chemotherapy followed by surgery, the survival rate for stage 3 ovarian cancer is tough to hear. Only 41% survive 5 years.
And so everybody's wondering, how do we get our chemotherapy better to those cells in the abdomen?
At Tufts Medical Center, doctors are already using this machine to heat the chemotherapy so it can be delivered during surgery to target other abdominal cancers. But recent studies have shown the treatment, nicknamed HIPEC, is effective for some patients with late-stage ovarian cancer. So Dr. Robinson offered it to Kathy, who agreed hot chemo was worth a shot.
I guess cancer cells die at 104. Normal cells die at 111, so this is 107 degrees, which is when I said I hope they bought the good thermometer.
And today, Kathy's ovaries and abdomen are cancer-free.
I know that I've improved her prognosis by her going through HIPEC, and that will at least get a survival benefit of potentially a year for her, and maybe, my hope, honestly, is that we've cured her.
The HIPEC procedure, and that's spelled HIPEC, requires expensive equipment, highly trained staff. So that's why it's only available at 2 hospitals in Massachusetts right now. One is Tufts, the other is Mass General. For more information, you can go to our website, WCVB.com.